Hello, everyone, and welcome to our 2020 State of the School Address. While we're not able to be physically together this year, it's important that we come together to reflect on the past year at the school, and for me to thank each and every one of you for the important role that you've played in helping our school to continue moving forward. Although we have a long way to go, we are moving steadily toward fulfilling our mission to foster an environment of academic and scholarly excellence that develops leaders who will improve the health and wellness of local, national, and global communities. As Sarah just said, should you have questions or comments, just please put your name in the chat box, and then she'll call on you after the address is ended. First, I would like to acknowledge the extraordinary circumstances we have navigated this year. As a school, we swiftly moved to virtual learning in the spring, traversed daily changes, and transformed Wendy and Beck halls to prepare for safe in-person learning in labs and simulation. As a nation, we have faced levels of division and uncertainty that most of us have never experienced. We gather today as the COVID pandemic continues to ravage our healthcare system and our economy, exposing deep inequities and exacerbating the suffering of so many of our neighbors and friends. Those communities and individuals who are disproportionately susceptible to economic and health challenges, particularly the Black community and other communities of color, have been even more exposed to the elements of a system that has and continues to fail to help and protect the most vulnerable. Captive in quarantines and lockdowns, the nation watched in horror time and again as videos and images of unarmed Black men and women, George Floyd, Daniel Prude, Breonna Taylor, and so many others, were brutalized and killed by those sworn to protect them. Our deeply fractured nation faces a reckoning with what is, for some, an uncomfortable truth, that this is not a new or isolated issue, that our systems and institutions are unjust, and that this injustice is ingrained in every aspect of our society, including healthcare and education. As nurses were thrust into the spotlight as the World Health Organization declared 2020 the year of the nurse and midwife, another obstacle came into view. Our frontline healthcare workers, including millions of nurses, were called upon to battle the novel coronavirus, often without proper protection or sufficient rest or respite. And the generation of nurses vital to keeping our communities safe and healthy were confronted with new personal, professional, and educational challenges as they navigated their already demanding programs. So 2020 has been defined by turbulence, trials, and tribulations, so many that it may be difficult to see the triumphs. But let us acknowledge and learn from the turbulence, and let us also celebrate the triumphs. In early spring, as communities across the nation went into lockdown, we faced our first trial, quickly moving our courses, clinicals, and labs to a virtual format. Our COVID-19 leadership team met daily to address and plan for emerging issues, and across the school, our faculty and staff mobilized to ensure our students were safe and able to continue their coursework. Our incredible technology services team, led by Tim Nab, ensured a smooth transition to an online learning environment. The team trained faculty members to teach via Zoom, implemented emergency classroom support, and moved clinical, lab, and simulation sessions online. This summer and fall, when we were able to return to in-person simulation and clinicals, thanks to the planning of our academic affairs and facilities staff, technology services enabled faculty to conduct labs synchronously across several classrooms in order to adhere to the physical distancing requirements. Not a single classroom was canceled. The experiences and technical expertise with online teaching, video conferencing, and remote applications of Jim Lichtenthal, Cheryl Oyer, and Peter Swatawi were integral to our success. Students didn't just transition to a new virtual environment amid a sea of uncertainty. They faced entering or continuing on in a profession vital to conquering COVID-19. Our faculty prepared them with skills and information for working amid a pandemic, including a series of learning modules covering epidemiology, COVID-19 symptoms and spread, caring for special populations, and phased reopenings. And when students could return to clinical rotations, our adjunct faculty were key in ensuring their safety. We also recognized the new emotional and financial struggles our students face. Our student services team and our faculty provided students with self-care and safety tips, access to mental health resources, personal support, and avenues to secure emergency funds for unanticipated financial challenges. Thanks to the Julia Viscaglia Fund, every student request for emergency funding was granted, totaling over $25,000 since March. Here's the story of how these funds have helped one of our family nurse practitioner students, Marion Thompson.
I decided to pursue my doctorate of nursing because I really enjoy the art of nursing. I feel like it was a calling for me. So I currently live in Clinton, New York. I'm a nurse practitioner. I work in Oneida, New York, which is a rural community. So in March, when the pandemic hit, I was furloughed because my tiny hospital was unable to maintain all of its employees. So I was furloughed in March for 2 months. My fears were, of course, anxiety, but also fears about maintaining my livelihood and what I would do in regard to paying my bills and maintaining my apartment. I wasn't sure how long I would be out of work or how long it would take for unemployment to kick in, if it would kick in. So I had a lot of concerns with just life in general. During all of this, I reached out to my UB advisor and let them know my fears and anxiety and what I was going through, and that I didn't feel like I would be able to maintain my studies currently. They were able to figure out a plan for me to continue throughout the summer as opposed to the spring semester. And they also asked that I apply for the emergency fund. So the emergency fund provided me with $1,000 immediately. It came through quickly and it was really needed at this time. You never know what's going to happen in life. This fund is very much needed and very much appreciated, I think. You know, when you're worried or there's some sort of emergency situation, it's nice to know that there's something there to help you.
I'm so very proud of our students for their resilience and so grateful to our donors for providing these emergency funds, including many of you in attendance today. Despite the deluge of difficulties, our students persevered. Over 2020, our 2020 graduates triumphed, walking the virtual stage during our unique online commencement in May. Our 2020 alumni also scored well above average on licensure and certification exams. Our pre-licensure graduates posted an impressive 98% NCLEX pass rate. Our DNP nurse anesthesia graduates had a 94% pass rate. And we just found out yesterday that once again, our family nurse practitioner program graduates posted a 100% pass rate. This is a testament to the dedication of our faculty and staff and to our students' dedication to their education and to the profession. Our devotion to our students underscores our commitment to providing our nation with nurses who are prepared to meet the complex demands of our current healthcare landscape. Our researchers also reaffirmed our commitment to our mission to improving the health of our community. As many research studies came to a halt, our researchers and students pivoted to confront the numerous effects of COVID-19. Our researchers are exploring COVID-19 related topics that include challenges in the ICU, a mindfulness app to reduce stress among college students, nursing home and ICU patient experiences, use of clinical simulations for nursing students, and sleep health among university students. And the school's first ever PCORI Award, $2.5 million, will enable our researchers to help adults living in low-income, racial, and ethnic minority neighborhoods reduce stress due to the COVID-19 pandemic. Working to address health disparities, both related and unrelated to COVID-19, is just one of the steps we as a school are taking to address systematic racism. Our Diversity and Inclusion Committee, with Amy Hecklenberg as our new Assistant Dean for Diversity and Inclusion, is working to address this inequity within the school, along with our faculty and staff. Two particular areas of focus at this time are mentorship and curriculum revision to better represent and serve people of color. This is an ongoing commitment to self-reflection, education, and real change through action. As you can see, we as a school faced many trials over the past several months, and as a united front, we have triumphed over many adversities caused or amplified by the COVID-19. Another triumph is the success in our faculty and staff continuing to forge ahead in other areas despite COVID's disruption of our daily lives and plans. Years of work by several faculty has resulted in the New York State Education Department's July 2020 approval of a concept-based curriculum for our pre-licensure students, which will begin in 2022. Concept-based learning challenges our students to think critically and prepares them to apply concepts to the many varied scenarios they will encounter in practice, providing these future nurses with cutting-edge baccalaureate education that encourages elevated thinking. Another triumph and testament to the importance of nursing and the quality of our school is that enrollment remains strong, thanks to the work of our student services team. A particular note, we had tripled our enrollment in the RN to BS program, far ahead of schedule, with 151 students enrolled in the program this fall. We are also proud that 3 of our PhD students received funding from the Society for Family Planning, Nursing Economics, and the Robert Wood Johnson Foundation. These awards will enable our students to contribute new knowledge to the nursing profession. Our faculty researchers also continue to impress. With 25 external applications during this past academic year, the Center for Nursing Research saw the school's largest number of grant proposals submitted. Some awards of note include a HRSA grant to support a collaborative care model in nurse-led primary care practices in underserved areas in New York, a HRSA nurse anesthetist traineeship program grant, a Robert Wood Johnson Foundation grant to improve services and care transitions for people who are homeless in Western New York, and an NIH grant awarded to study quality of life and end-of-life care transitions for individuals with Alzheimer's disease and related dementias. This NIH grant was Suzanne Sullivan's first NIH grant proposal. It is quite an achievement to be awarded an NIH grant funding on your very first submission. This and our researchers' collective continued growth and success is a testament to the strength of our school and our commitment to improving the health and wellness of communities across the globe. Another testament to our dedication to excellence is the many accolades received by our faculty this past year. These include a Fellow of the International Academy of Addictions Nursing, the Margot McCaffrey Nurse Exemplar Award, the Advanced Oncology Certified Nurse of the Year Award, and the Exceptional Scholar Sustained Achievement Award, to name just a few. I would also like to acknowledge and welcome the 3 new faculty and 3 new staff members who joined us since the last State of the School address. It's already challenging to begin a new role under normal circumstances. We are grateful for them to have them as part of the School of Nursing team. We're happy to help them take the next steps in their professional careers. Beyond our students and faculty, the nursing profession has received much recognition and support during the Year of the Nurse and the Nurse Midwife, particularly during Nurses Month. We received dozens of thank you messages from across New York State and the UB community, from heartfelt expressions of gratitude to touching personal experiences with nurses. These messages were shared widely across our social networks, earning nearly 200,000 impressions, over 8,000 engagements, and over 500 page views on our website. During Nurses Month in May and beyond, we reported on the many ways nurses are in the front lines combating COVID-19. Our students, faculty, and alumni stepped up at their places of employment, working overtime, manning testing sites, sewing masks, volunteering as first responders, collaborating with county health officials, and leading the transformation of units and entire hospitals to treat and prepare for influxes of COVID patients. As our alumni checked in and shared their stories with us, we also reached out to them to show our appreciation and support, and pivoted our usual alumni programming to a virtual environment to stay engaged. Between May and November, we held monthly sessions, a variety of topics, including health disparities, self-care, racism in nursing, and tips for new nurses, with over 350 total attendees. Appropriate to the season, last week we held a virtual celebration of donors with wonderful tributes from students and alumni for these generous individuals who have been instrumental in supporting our school and the future of the profession. We are so grateful to have the generous support of these donors who are helping us transform and define the future of nursing education and clinical care. Thanks to them and many of you, in fiscal 2020, the school reached 85% of our Boldly Buffalo campaign goal of $6 million. 171 donors contributed to our Julia Biscaglia Emergency Fund, with 120 of those donations totaling over $25,000 occurring since March. And we launched our new fund for the School of Nursing, the Justice, Equity, Diversity, and Inclusion Fund, nicknamed the Jedi Fund. It will be used to support diversity and inclusion education and training at the school. While the pandemic rages on, we will certainly encounter new and unexpected challenges. Many of these challenges are and will continue to be financial. In April, Governor Cuomo directed state entities, including SUNY, to reduce spending where possible to mitigate the financial impact of COVID-19. The current 10% state reduction in spending and the hiring pause is just one of these challenges we will continue to manage moving forward. What we can expect is that this will be temporary, and as will many of our other challenges related to COVID-19. For now, we will continue our incredible teamwork, supporting one another as we ready ourselves for what's on the horizon. We can look forward to the future when we can take a collective breath and reflect on these challenges in order to forge a better and more just path forward, not just as a school or a profession, but as a society. I am so proud of the myriad ways our school and our community have come together to support our students, each other, and the nursing profession. I could not be prouder of our faculty and staff for your strength and resilience amid so many uncertainties. I know that many of you are juggling your work at UB, clinical practice, children, and for some of you, older family members. In the darkest times, each of you is a light for our school, having thoughtful conversations, finding creative solutions, and guiding our students to success and safety. As we continue to traverse uncharted waters and weather this storm, I have the utmost confidence that our School of Nursing team will overcome the many challenges we will undoubtedly continue to face. I am so thankful and grateful for the role each of you played through this trying time, and I have the utmost faith in our ability in a team to continue on our path despite whatever new or familiar difficulties we may encounter. Individually, you have all shown just how incredible you are, and collectively, we have shown that the School of Nursing is truly U Buffalo strong. As I close, please join me in thanking Sarah Goldthright, our Director of Communications, for distilling our year into such a tremendous presentation. I am forever grateful. Thank you so much for allowing me to be your dean.